Hello. Welcome to a belated case of the month. And this time we have a 60-year-old female patient. And she presents to the emergency ward with fever and easy bruising, and has ecchymotic lesions, several ecchymotic lesions on her body. CBC reveals severe pancytopenia, and imaging reveals findings consistent with pneumonia, and the patient is checked for COVID-19, the PCR of which turns out to be positive. Here you can see the peripheral blood smear of the patient, and before I zoom in, what we can see here is that instead of the mature blood cell elements, what we mostly see are more mononuclear, immature appearing cells. When we zoom in a bit, we can see cells with blastic chromatin and kidney-shaped nuclei, or some with bilobed nuclei. Over here, again, a bilobed nucleus. I'm going to, as I said, zoom in, but we can even make out a bit of granulation within the cytoplasm of this one. But you can see that these are all immature appearing cells. Now, when you look carefully, you also come across, as you can see again, these mature blastic cells. You also come across cells with multiple Auer rods within the cytoplasm, as you can see over here. See, this is a cell with large multiple Auer rods within it, and here's another blastic cell. Again, another cell with Auer rods within the cytoplasm, and another one. Here's another cell. This one's purely granulated, poorly granulated, but it again has a bilobed nucleus. And again, blastic cells with bilobed nucleus. Now, these are all findings suspicious of, here's another cell which is an atypical granulated, again, immature appearing cell. These are findings suspicious of acute promyelocytic leukemia. And then the patient here are the blastic bilobed cells, again, and this time probably in a typical promyelocyte with dense granules that obscure the nuclear cytoplasmic border. Densely granulated. Here's another one of those typical cells. And another blastic cell. And the patient later, of course, undergoes a bone marrow biopsy sample. A bone marrow biopsy, the sample of which is brought to our laboratory, and I'm going to show that to you next. Seeing if I can find other cells with multiple granules, which are called phagocytic cells, which are characteristic of acute promyelocytic leukemia. Again, here's another one. This is very typical. It's stuffed with multiple Auer rods, the cell is. Now, this is the bone marrow sample, biopsy sample. As you can see, again, this time we have a diffuse infiltrate. The marrow space looks extremely hypercellular. And when we zoom in, we can see that this is actually a very highly monotonous population of cells. And it seems as though they've got eccentric nuclei and fairly broad cytoplasm, pink cytoplasm, which can actually be made out. From this magnification, you might even think they might be plasma cells, and we're looking at a multiple myeloma. But again, when we move in closer, we can make out that these cells have actually a granular cytoplasm. They've got blastic chromatin, so the chromatins, And you can make out forms again with bilobed nuclei over here. These again, look, this one's quite plasmacyto looking, but again, this one has a very blastic chromatin, as you can see. Again, one with a bilobed nuclei. This suggests, again, makes us suspicious of a promyelocytic leukemia, promyelocytic differentiation, the eccentric nuclei of these cells and voluminous, relatively voluminous cytoplasm, pink cytoplasm. With immunohistochemistry, these cells are negative for CD34. This is the CD34 stain. As you can see, only the blood vessels of aspirate smear was actually fairly devoid of cells, didn't have any particles within, but when we zoom in, you can see that most of these residual cells are densely granulated cells which resemble promyelocytes, a typical promyelocyte. And I'm going to show you, as here you can see again cells with multiple Auer rods. Again, highly granulated cells. They've got dense granules, they're densely granulated. I've moved to an area where the morphology is a bit better. The cells are a bit more intact. As I said, the aspirate was not optimal, but as you can see over here, you've got these cells which are densely granulated. You can barely make out the nucleocytoplasmic borders. You've got these with multiple Auer rods within their cytoplasm. And here's another cell with multiple Auer rods that have dispersed all around it. Here's another cell with a bilobed nucleus and multiple Auer rods within its cytoplasm. These cells, as you can see here, are called phagot cells, and all these other cells are the atypical promyelocytes of acute promyelocytic leukemia. Here's a more blasting appearing cell. Again, the cells with bilobed nuclei and abundant cytoplasmic granule and multiple large Auer rods. Again, one over here, which are called phagot cells, which are actually highly characteristic of acute promyelocytic leukemia. It's another one. Thank you for listening.